Hello everyone, welcome to this video where we will be talking about HSG, that is hysterosalpingogram. So before knowing HSG, always remember that how to do HSG and how we interpret the films. Now look at this patient. This is an HSG film which has been taken. There are multiple films which will be taken. The first film is called the Scout film, SCOUT, Scout film. Scout film means the first film when the dye is not instilled. So this is just a plain X-ray of the pelvis which is being taken. After that, what happens? You instill the dye inside and then you take multiple films at 10 to 15 seconds interval. By then the dye will go inside and it will fill. Now what do we use for instillation? First of all, through the cervix we insert the Leach-Wilkinson's cannula. Leach-Wilkinson's cannula will be a cannula like this where there will be serrations on it. The serrations will help to grip on the cervix so that the cannula does not come out and the dye does not come out. So Leach-Wilkinson's cannula use karke we put it inside the cervix and then we instill the dye. Now in this picture the Leach-Wilkinson's cannula is not visible because the dye has been instilled through a Foley's catheter. Sometimes if it is instilled through the Leach-Wilkinson's cannula, then it will be visible of course in the X-ray. Now how much of dye to instill? Always remember we instill 10 ml of dye. This is a very important question. This is because the endometrial cavity, that is the uterine cavity, has a volume of 7 ml and 3 ml we instill for the tubes, because we have to see the content of the endometrium and then the tube. So a total of 10 ml is only injected, not more than that. Now what type of dye is injected? So for injecting the dye, you should remember there are two types of dye. One is water soluble dye, the other is oil soluble dye is available. Now water soluble dye is very friendly because patient will have less cramps, less pain with water soluble dye. But delineation of the cavity, the endometrial cavity and the tubes are better with oil soluble dye. But many people are allergic to the oil soluble dye. So you have to balance the pros and cons for giving oil versus water. Cramps and pain are less with water soluble, but delineation is better with oil soluble. The most common example of water soluble dye is meglumine diatrizoate. Meglumine diatrizoate. Very important, this comes as a question in examination. Okay, it is also called iohexol. Okay, meglumine diatrizoate water soluble dye is most commonly used in most of the hospitals. Oil soluble dye can be in the form of ioperidol. Ioperidol can be an example of oil soluble dye. Now once we have read all the dye, all the Leach-Wilkinson cannula, what actually we do with the patient? This HSG is of course done for infertility assessment, whereby the tubal patency is checked. Now see in this film, the Scout film has been taken to see that the pelvic cavity and everything is normal. Now in the second picture, the dye has been instilled. So this dye spreads to the endometrial cavity, uterine cavity, and it goes to the tubes, and you find there is a blockage in the middle portion of the tube. Distal part of the tube there is blockage, which is confirmed in the third because there is no spillage in the peritoneal cavity. So how in exam if it is given, I will tell this is a hysterosalpingographic film showing the Leach-Wilkinson cannula or the catheter, whichever you see, then the endometrial cavity or the uterine cavity is visible. If there is any space occupying lesion, that is submucous fibroid or polyp, then the cavity will be irregular, that is the cavity will be shown like this. Suppose this like this it will be shown, or like this it will be shown. Okay, so if the cavity is irregular, then you will tell this is a space occupying lesion. Now the thing is that how to differentiate between a space occupying lesion, suppose a fibroid or polyp, and on the other hand there can be a gas bubble also. Gas bubble can also show a space occupying lesion, but gas bubble will change its position in every film. So, it will be lower down, then it will go up with the subsequent films. But if it is in the same position, then it is a space occupying lesion, that is, it can be a fibroid or a polyp, that you can comment. Then coming to the tubes, if the tubes are normal, then the tubes will be seen and there will be free spill later on. If there is blockage at any part of the tube, then you can see. Now, if the tubes appear beaded, if the tubes are appearing beaded, then this is a very important question. What do you diagnose in this case? Then you diagnose genital tuberculosis. Tuberculosis of the tubes, TB of the fallopian tubes is very common in Indian scenario. This classical picture of beaded appearance of the tubes is called salpingitis ischemica nodosa. Very important question for NEET PG. Okay, nodosa. Salpingitis ischemica nodosa is beaded appearance of the tubes which is found in HSG, but HSG is contraindicated in genital tuberculosis. Remember this. If somebody has an established diagnosis of tuberculosis, do not get HSG done because it will disseminate the tuberculosis. But it can be an opportunistic finding where you don't know that the patient is having genital tuberculosis, you may find this thing. Apart from that, what other features can be found in the tubes? Number one, there can be leopard skin appearance. Okay, there can be lead pipe appearance. Okay, lead pipe appearance में क्या होता है, ट्यूब्स एकदम स्टिफ हो जाता है, छोटे से हो जाते हैं. Then there can be retort shaped tube. These are all questions what come. Then you have tobacco pouch appearance. Tobacco pouch appearance में there is a classical picture that the uterine cavity will be found and then the tubes will be found, and the later part of the tube there will be dye will be collecting like this. So, this is because there is at the femoral end there is blockage of the tubes. So, this may happen, tobacco pouch appearance. So, these are the findings which you may find. So, finally, this is how we interpret the HSG. First, you have to comment on the endometrial cavity, uterine cavity, if it is normal or not. One more thing which can be diagnosed is the uterine cavity, whether it is a bicornuate uterus or a septate uterus, it will look like this. Okay, it will look like this and the tubes will be seen and there is spillage of the dye. Okay, so in this case you cannot differentiate by HSG whether it is bicornuate or versus septate. So, how to differentiate between bicornuate and septate? You have to go for DHL. DHL is diagnostic hysteroscopy and laparoscopy. By hysteroscopy we see the inner cavity and by laparoscopy we see the upper part. So, you have to differentiate between the two by diagnostic hysteroscopy and laparoscopy. This will be the test. And for evaluation of this thing, infertility couple, apart from the tubal test, you have to undergo test for ovulation as well as test for the endometrial cavity. Thank you so much.